Welcome to this edition of The Doctor Is In. I'm Celia Longoria, and I'm joined by first on-site physician Dr. Raquel Bolado. She's here to talk to us about impaired glucose tolerance. Well, what does this mean? Let's start asking her the questions. She's going to tell us all about it. Welcome, Dr. Bolado.
Thank you.
Okay, we're going to start off with what is normal blood sugars?
Well, that depends at what time of the day the blood sugars are taken. A fasting blood sugar is when someone has not eaten within 8 hours, and that value should be below 100. There's also a random blood sugar, and that can be taken at any time of the day, regardless of the last meal. That should be below 125. There's also a 2-hour blood sugar, and it's called a 2-hour postprandial blood sugar. That is 2 hours after a meal is eaten, and a normal value of that should be below 145.
So if you can talk to us a little bit about what impaired glucose tolerance means.
Impaired glucose tolerance is also known as IGT or prediabetes. According to the World Health Organization and the American Diabetes Association, it is when a person has a 2-hour oral glucose tolerance test, and at 2 hours, their blood sugar values are between 140 and 199.
So how prevalent is IGT?
IGT is very prevalent, not only in the United States, but worldwide. According to the United States Health and Human Services, in 2007, 1 in 4 adults over the age of 20 had IGT. Current statistics are showing that 10 to 15% of the adult population in the U.S. have IGT.
You mentioned that it is also known as prediabetes. Can you tell us a little bit more about that?
Yes, the pre-diabetic stage is a condition where the pancreas has impaired insulin secretion and the body cells have insulin resistance. What does this mean? It means that the body cells are not able to properly use the insulin. They're not able to take in and use the glucose that the body cells need.
Mm-hmm. What are some of the symptoms of IGT and prediabetes?
A lot of the people and patients don't have any symptoms at all. They don't even know their blood sugars are not in the normal range. And there is a severe form of insulin resistance known as acanthosis nigricans. And this is where people have dark coloration around the neck area. And even in schools and elementary schools, they're screening for this.
Mm-hmm. I know that that's one of the things that our school nurses are checking for. Like you mentioned, for the younger children that are in our school, that is one of the things that they're keeping track of because it seems like it's become more widespread.
That is correct. When the nurse finds that someone has the dark coloration around the skin, also known as acanthosis nigricans, they send a letter to the parents for the child to get checked with their blood sugars.
Is there a treatment for IGT?
The treatment for IGT, well, the goal is to try to prevent diabetes. So the treatment for this is trying to maintain activity, trying to be active and exercising on a daily basis, preferably 1 hour per day. Because when we exercise, our muscles use sugar as energy, so they'll bring down the blood sugars in the blood. Also, trying to stay away from concentrated sweets, which I named the 5 C's: cakes, cookies, candies, regular Cokes, and all types of chips. The ultimate goal is to try to maintain our ideal body weight, which should be less than 25. And by watching what we eat and exercising, we can have a better chance of maintaining our ideal body weight.
Also, if there's someone with IGT, will they always have it?
Not necessarily. Studies have shown that 40 to 50% of the population will become diabetic in 10 to 15 years. 30% will revert back to normal. They'll go back to normal blood sugars. Mm-hmm. And 10 to 20% will always have impaired glucose tolerance.
You've talked to us for this particular show about impaired glucose tolerance. You've given us a lot of real good information. We're getting also questions that we'd like to ask One of the questions on here is, who's at risk for becoming pre-diabetic and having impaired glucose tolerance?
Celia, there are several risk factors for having impaired glucose tolerance, and I like to group them into those that can be controlled and those that cannot be controlled. Those that cannot be controlled are generally genetics, family history. If we have a family history of a parent or grandparent or grandparents being diabetic or having impaired glucose tolerance, chances are that the offspring will also have impaired glucose tolerance. Also, our ethnicity, being Mexican American or African American, can increase our risk of having IGT. Aging, we have no control over aging. The older we get, the more we are at risk of becoming IGT. Those risk factors that we do have control over are obesity, our lifestyle activity, and maintaining our ideal body weight. The more sweets we eat, the less active we are, increases our risk for having IGT.
There's also been some research that indicates that women that have a baby that's over 9 pounds, that's also a risk.
That is correct. Women who have babies over 9 pounds, they have babies over 9 pounds because their sugars are high. The baby feeds off the high sugars and starts gaining weight.
Okay. If someone has IGT, how often should they be checked?
Patients who have been diagnosed with IGT should at least get a yearly blood test, and it's called a hemoglobin A1C. This blood test will let us know if these patients with impaired glucose tolerance are becoming diabetic.
So there's, from our end, as an individual, you pointed out some really interesting information as far as the diet, the exercise. We want to make sure we don't lead sedentary lifestyles. That's all very important, and also that we should be getting at least 1 hour of exercise per day.
And that is correct. So I encourage everyone to at least get a yearly physical. That way they can have their sugar checked and make sure they're not becoming pre-diabetic.
All right, well, I think we've covered all the different areas that we highlighted for this particular report. We thank you for joining us today. We know you have a very busy schedule, but thank you for joining us today.
Thank you.
That's it for this edition of The Doctor Is In. Thanks for watching, and we'll see you next time.